In the previous section of this series, we discussed proper techniques and procedures for a professional dental cleaning. In this section, we will discuss the veterinarian's role in evaluating and maintaining the dental needs for the pets that come to your veterinary hospital. The veterinarian's role in examining the teeth and gingiva is very important in discovering subtle problems that might have significant long-term consequences. For example, evaluating the depth of the gingival sulcus is very important because it makes the veterinarian aware of periodontal problems. A periodontal probe with lines marked every 3 to 5 millimeters is used to evaluate the depth of these pockets. When a probe can be inserted beyond 3 millimeters in a dog or 1 millimeter in a cat, there is likely periodontal disease present. The veterinarian will also evaluate loose teeth to see if they need to be pulled. The extraction of teeth is a last resort, but may be necessary in the late stages of periodontal disease. If a tooth extraction is necessary, always inform the pet owner beforehand and get permission before the procedure. You should also check with your state licensing board, as most states require that only the veterinarian is allowed to perform the extraction. Tooth fractures are often a concern because of a dog's chewing habits and the fact that most tooth fractures and excessive tooth wear will expose the pulp cavity. Whenever the pulp cavity is exposed, we open up the possibility of allowing an infection into this most sensitive area. Once an infection gains access to the pulp, it quite often will lead to a root abscess or systemic infection. This tooth will often require either a root canal or extraction. Cavities are areas where the enamel has eroded away, leaving behind a hole or resorptive lesion. Cavities are rare in dogs, but are more common in cats. These cavities, or cervical line lesions, frequently occur along the gingival margin in cats and can be repaired by filling them with a cement to prevent further sensitivity and to protect the tooth. The mouth is also the location for a variety of dental growths and tumors. Upon evaluation, the veterinarian can determine the significance of such growths and make a decision as to whether they should be removed or not. All abnormal findings should be documented in the medical records by the veterinarian or the technician performing the dental cleaning. Tooth fractures, loose or missing teeth, and periodontal disease should all be recorded in the patient's record. Dental charts or stickers make for easier detailing on the location of such lesions. Because the dog or cat's mouth is a source of a wide variety of bacteria, the use of antibiotics at the time of dental work is often indicated. Scaling infected tartar from the gingival sulcus inevitably produces a showering of bacteria into the bloodstream. This wave of bacteria can lead to secondary infections in the heart or other vital organs. Pets with severe periodontal disease should be placed on antibiotics several days prior to the dental procedures and maintained for a number of days beyond the procedures. Your veterinarian will be able to assess the need for such antibiotics with each individual patient. After the teeth have been professionally cleaned, it is an excellent time to educate the owner to the merits of brushing their pet's teeth for future prevention. Beginning a brushing program prior to tartar buildup will be very rewarding to the owner in attempting to maintain their pet's dental health. Another consideration after an animal has undergone dental work is the ability of that patient to chew hard food for several days after the work has been done. Though most dogs and cats do not seem to have a problem with this, occasionally 1 or 2 days of a soft canned diet is necessary to help with the sore mouth and gums. As quickly as possible, however, we would like to resume eating hard foods because of the tartar control afforded by these diets. While it may be obvious that medical conditions such as a cancerous mass formation in the mouth cannot be prevented, other dental problems can be avoided. For example, many popular indestructible bones are the cause of breaking destructible teeth. The client will likely learn the hard way that a puppy will chew on just about anything while it's teething. But what happens when the pup grows up? Do adult dogs become less interested in chewing? What types of chew toys provide mental stimulation and satisfy the urge to chew, yet won't fracture any teeth? Flexible rawhide chews and treats coated with chlorhexidine gluconate are just one of the many options. By supplementing brushing their pet's teeth with this type of chew or treat, the client gets a night off while still participating in an oral hygiene program. And finally, it's important to realize that many of the same dental procedures that are being performed on people now are available to our pets. With animal dentistry becoming a recognized specialty within veterinary medicine, we have witnessed a multitude of procedures and treatments becoming available. Dental x-rays, for example, have become commonplace in many veterinary hospitals. With this imaging device, veterinarians are able to evaluate with x-rays the condition of teeth and their surrounding periodontal structures. Root canals are another commonplace dental procedure in some veterinary hospitals and with veterinary dental specialists. The root canal procedure helps save teeth that have exposed or damaged pulp cavities. The content of the pulp cavity is cleaned out, sealed with a cement, filled with an obturating material such as gutta percha, and the access is closed with a restoration or crown. This eliminates the chances of infection taking habitat in this sensitive area. In some of these cases, restorative dental procedures such as crown placement might also be done. Placement of a crown involves replacing the missing portion of the tooth with a metal or porcelain model shaped exactly like the tooth. The crown is permanently cemented in place and offers the animal the continued benefits of that tooth. Periodontal surgery is also commonly performed by the specialist in order to restore diseased gingiva and supportive structures. Even orthodontics has its place in realigning the animal's teeth to achieve a healthier, more natural bite pattern. That's a quick overview of a pet's dental health needs. Hopefully, you will appreciate the importance of educating the pet owner to their pet's dental needs and the preventative steps that can be taken to prevent more serious problems from occurring. The goal of the veterinary team should be to increase client awareness about the importance of oral hygiene for their pet. Ideally, this type of education will start when the pet is young, so routine toothbrushing becomes familiar and perhaps somewhat pleasant. The pet is more likely to respond favorably to this type of attention if it is done slowly over a period of time. As the pet grows, the home dental care program should be designed to work in conjunction with regular dental checkups. Yet regardless of the age of the animal, if the veterinarian discovers a potential problem during a frequent oral examination, there are now many options available. Once upon a time, a root canal on a cat was likely to be considered experimental, and canine orthodontics, was unheard of. Thankfully, veterinary dentistry has come a long way since then, and currently specialists in the field perform a myriad of dental procedures daily. In closing, it is vital to implement dental health programs that center on the owner's relationship with their companion. If the client is encouraged and reminded regularly how important a healthy mouth is and how they can help achieve that health, they are more likely to be an active and hopefully proactive member of the team.